Hello, there's no one live in the chat yet, but for people who are watching later, I'll be going through the Monash MMI interviews, so the basic structure and my experience and all that. Hello. I see a couple people have joined. I'm not sure when I'll start. Maybe 8:25, 8:20. Um, yeah. If you guys have any questions at all, just drop them in the chat. I'll be happy to answer them while we wait for some more people to join. And if you guys have had any interviews already, I'd be very interested to hear how they went, interstate, or if you're from overseas as well. Hello, welcome. Maybe I should write this. So, any questions about my experience or what it's like? But yeah. Also, ATAR results are coming out soon. So, yeah. I wonder how you guys are feeling about that. I think it's on Thursday that the results come out. Hello, Aria. Thanks for joining. How have your holidays been? What makes it weird? The fact that you're suddenly not studying, or the fact that it's holidays and you still have interviews to prepare for? Oh, okay. So you're in year 12 next year. Right. Yeah. I was pretty nervous as well because it's the big year. You know what subjects you're studying next year? But yeah, definitely I think doing some early study will probably help your nerves. And yeah, I mean, that's the only thing. Probably try and calm yourself down as well. I think we'll get started at 8:25. I doubt there'll be many people because I don't think I advertised it that well, and plus a lot of my viewers are VC as well. But we'll start 8:25, I think. Right. Chem, physics, spec methods, EL. Language? What's language? Like you're doing like French or something, or that's a good lineup. I think physics, spec methods will be. It's very heavily like maths, and you're doing six like I did, which is an interesting choice. Is there any reason behind it? Do I recommend to finish the whole book in the holidays? I'd say there's no point finishing the maths books in the holidays or like chem or that kind of thing, because the course is really big and I don't think it's very thorough to go through it. But I think for English, definitely read your books. That's really important. And for a language, if you're doing Persian, you'll have the oral. Definitely start writing and hopefully even finish your general conversation. I think that's like very important. And Persian's a very interesting language. As in, like, I don't think I've met someone who studied that. Hello to the other people who've joined. Yeah, so drop any questions you have. The chat will be starting at 8:25. It's just pretty chill. Like, I'll just be talking about the interview. And if people want to, I can go through like a couple scenarios and stuff. But we'll see how we go. Also, if I look like away from the camera, I have my phone there with the chat, because if I scroll, I realize people get frozen, and I have my iPad down here to write on. You're good at Persian. Okay, that's good to hear. I do think you need to, like, you still need to prepare for general conversation, content wise, right? Like, if they ask you, what are your hobbies? It's good to pick hobbies that are unique, or if not unique, like important to you, like you're passionate about. Whereas, like, even if it's your first language, they suddenly ask you, what hobbies do you have? It's a bit hard to give a really, really good answer. But it's good that it's your first language. Chem and Spec is something else. Yeah, yeah, they're definitely pretty hard subjects. Chem is a lot of content, and Spec is just pretty hard maths. Um, yeah, I'd say, like, just take time with it, right? You don't need to be rushed at all. The year hasn't even started. Just really, if you want to pre-learn something, pre-learn it like well. Don't feel like you need to rush or anything like that. It's much more worthwhile knowing a few things well than knowing a lot of things, kinda. How are your holidays going, everyone? Holidays going well? Anyone who has had interviews? Anyone who's finished year 12? I'm really keen to hear how. All right, we'll get started. 8:25. If you guys have anything, just drop it in the thing. So anyway, Monash interviews. So Monash runs a MMI style interview, which means they don't really care as much as, like, it's not like a classic interview that you think of, right? It's not like why do you want to study medicine? What type of person are you? They're not really looking to find that directly. The way they're trying to find that is through, like, the questions. So what I mean by that is that instead of asking you why do you want to study med, oftentimes they give you a scenario. For example, a very classic scenario is, let me write this. So you're going back to school. So you're a like a physician, you're a doctor already, and you're going back to school and giving a career talk. Career talk. And essentially they'll ask you what you're gonna talk about, and that's essentially why you want to study medicine, right? You got to just explain the reason why you picked being a doctor, and it's just a more subtle way of asking it than asking you directly. But apart from this sort of indirect personal style, so indirect personal questions, the very classic outline of this kind of interview is that they give you a scenario plus questions. If you've practiced, you know, they give you a scenario. You're either a physician, a nurse, like a med student, and they'll put you in a certain scenario which has, you know, moral concerns and all that, and essentially they'll ask you questions relating to like how you respond to certain scenarios. For the logistics of Monash, if you're going there, you probably know, but essentially you find interview offers. I'll just give a brief outline. Interview offers. So 20th December, in that week, you'll receive your offers. um, unless you're sort of overseas or your second round interviews. And the actual interviews are 4th to 7th of January. And they'll be over Zoom. I'm fairly sure they're over Zoom. And yeah, so you'll get a link and you have to join the meeting and all that. All right. So with my personal MMI experience, the way they do it is they put you in breakout rooms because you're not in person. And the timings are, let me scroll down a little bit. Timings are 8 minutes. Timings 8 plus 2. So essentially there are 8 minutes of like the interview process, including them asking questions, all that, and 2 minutes of sort of changeover, and the people need time to score as well. Okay, I just answered some questions. All right, when did you start practice exams? I started practice exams for maths like around January. Oh, sorry, around July, not January. And for some of the other subjects, a bit much later in the year. But generally, I think around July, August is a good time to start practice exams. You're going into year 12. Do you think it's a good idea to get super ahead of the classes you're doing? If you feel like it'll make you more confident, then do so. I didn't really feel the need to, except a bit in maths, and I don't think it was that necessary. Like, I don't feel like it helped much. If you want to get ahead, I highly recommend you do it, but do it properly. Like when you learn things, learn it properly. Make sure you understand the questions. You can do it well, rather than doing a bit of everything. But you're both going to year 12, so good luck for sort of that year 12. And I'm open to VC questions as well if people in the chat are not, med students or not like graduated year 12. All right, so timing's 8 minutes plus 2 minutes. Cool. Right, so I'll go through a couple. Also with the stimulus, they put it in the chat because so they don't hold it up or anything. They paste it in the chat, give you time to read it, and then they sort of check whether you're okay, and then ask you to answer questions. It's pretty chill, honestly, especially over Zoom. I don't feel like it's that intimidating at all. And the people that I had were fairly young as well, which sort of helped, right? Because they didn't feel like really like aggressive or anything like that. But all right, let's talk about a few sort of concepts, a few sort of foundations of interviewing. So we'll talk about the content first. So let's have a look at content. All right, content. So there are a few principles that you should sort of base your answers around. So the first principle and the most obvious one is that you should put the patient first. Which means that when you discuss certain issues, the patient should be a really big part of what you talk about, and what action you end up taking, what decisions you're taking, should almost always have the best possible outcome for the patient, because that's really important as a doctor. Whereas things like sometimes there's a scenario later where the patient didn't get the patient didn't give consent, but the senior doctor still wants you to do something to the patient. You really got to put the patient first whilst managing your relationship with the senior doctor. Basically, in 0 cases of questions they'll give you will you have to endanger the patient for some reason, because that's like not the point of being a doctor, and it will have to be a very, very extreme scenario where that will happen, and it's not something they'll ask in an interview. So patient first. You have to consider patient in the prompts. All right. Secondly, what's really important is confidentiality. And certainly, this is patient confidentiality, but also you won't necessarily have like a patient. There's also your friends as well. So it's not always going to be a scenario based around a patient. Sometimes there was a scenario where like I saw my friend at this abortion clinic, and sort of what I would do then as well. So in those cases, you really just got to remember, like, not to tell other people's secrets and to respect other people's um, sort of privacy as well. So confidentiality of your patients and confidentiality of others is really important. And also in things like conflicts, confidentiality applies as well. You don't really want to escalate things immediately. You really want to confront the person first and really assess the truth of things. So you don't really want to go based on sort of secondhand information. So confidentiality is both patient, but sort of friends and what do you call it? Like work friends as well. And thirdly, so these are principles that kind of apply to basically every scenario. There are probably more minor ones, but you'll sort of encounter them as you practice. And thirdly, you really need to consider everyone. Oftentimes people find it quite hard to be really broad in your thinking, to like cover all your bases. But a really good way I find of doing that is just thinking about all the people involved, how they feel about a respective issue, and then addressing sort of each person's issue and then weighing up sort of who's more important. So you probably have, a nurse, a doctor, the patient, you, and you think about, okay, so the patient's confidentiality is at risk here. The doctor's authority is at risk here. The nurse is sort of on my side. So you really got to assess each of those things and like talk out loud as you do it. And that's sort of how you make sure that your answer is really encompassing of everything that you need. Okay, let me answer some questions. How do I excel in English? I have a lot of videos on that. But just try and improve your writing each time you write. And really, when you write your essays, put a lot of effort into it. Find the best moments, because your essays are what you end up writing on the exam and in the SACs as well. Max, hello, long time no see. Are you coming back to Melbourne, by the way? Max is at in America, New Chicago. Stuck in the same level of English skills and not improving. You don't know what to do. And not improving. Yeah, so the best way to improve is through essays. In year 12, like I improved a lot. It's really hard to improve outside of that. If your vocab's bad, then I do recommend learning like better vocab. But once again, when you write your essays, find better words for things. Especially if your book is about like destruction or whatever, try and find words related to destruction. And it's pretty like that's how you improve, because all your essays are relevant to your book and the exam's going to be relevant to your book, whatever. And so really putting an effort in your essays will help. Oh, not this break. Okay. How's U Chicago, by the way? Are you enjoying it? Do you need to do leadership positions? Okay, with leadership positions, you don't need to do them for Monash medicine. Probably for like overseas and stuff, you need leadership positions, but for med, they just look at your scores and your interviews. But the only case where you can bring out sort of leadership skills is in your interview. So if they have a scenario that's kind of relevant, then mention it. For example, I had a question about like, what was it? Yeah, so why I wanted to study medicine. It was like a careers night, basically like career scenario. And I mentioned that I did work experience in a hospital. So that was a chance for me to sort of show my experience and, show my experience. Whereas if you didn't do that, you can't really say it. All right. Apart from this sort of concepts that dictate your content, there's also like how you structure your answer. So let's have a look at that. Structure of answer. Let me write this. Let me scroll here. So like I said before, you want your answer to address everything, right? Address all the key issues. And by doing that, you just consider everyone. That was the easiest way I found to do it. Consider everyone and their relationships and your relationship to them. Like literally go through each person. Even in reading time as well, when they give you time to read, that's quite good because you can kind of guess what answers, what questions they're going to ask. Like, right? Like, what are the key issues here? Um, what would you do? Like, yeah, like those are pretty, obviously they're going to ask those questions. And the second thing I think is to take some moment to think about how to actually structure your answer. Okay, and things like sort of general sentences help quite a bit. For example, if someone asks you, what are the key issues? You can say, there are many key issues here which apply to the doctor, the patient, and me. So just a broad sentence like that gives you time to think, but it's also like, it's not too repetitive. It actually like sort of acts like a topic sentence, which is quite good. So general sentences, sort of topic sentences help. Yeah, so topic sentences help. And with your structure, it is useful to think about people as well. Like oftentimes there might be like a child involved and their parents. So you might say, okay, so first I need to address the child's fear of whatever. However, I need to take into consideration the parent's role as their guardian as the child is under 18. For the mother, she is, very worried for his well-being. I will try and talk to her, explain to her that this is the best course of action. For the father, he is more strict with the child and wants the child to go through with the scenario. To address that, I would. So like go through each person and sort of give set the scene a little bit, like what's their issue. So the mum's like really worried for the child, the dad's a bit overbearing, and talk about how you're going to combat it. So that's a really clear, like, this is the problem, this is how I'm going to address it, and then do it for like everyone. And basically you've got a really good answer already. So let me write that down. All right. So issue plus sort of how you will address it. For every person. Cool. Do you guys have any questions at this point? Let me have a look. Oh, really? You do well in everything? That's really good, Max. You're excelling, representing Australia well. With Parry. Oh, boo. I forgot your. What's an expectation that you had before going to Monash? It turned out to be the polar opposite. I think med students quite like to party and stuff. I didn't expect that. I think that was something that quite surprised me. Like I've heard about it, but like I just didn't expect it because you just don't think it's going to be the case, but it is the case in uni. Like a lot of partying, clubbing, things like that. Yeah. Extracurriculars, volunteering, leadership. Like I said, it's not important in the fact that you don't need to hand in something with all your achievements listed. But it is good to mention in the interview if you have it. And it's definitely really good. So for example, people ask you why you want to study medicine or be a doctor, right? If you've actually gone to a hospital, it's much, much stronger than someone who hasn't. And if you've done work experience, even better. And you go into specifics, right? I looked at this, I did this. I watched the doctors, followed the nurses. Parry, it depends, right? Generally, I think it's good to do a bit of each subject, like, because you have homework for most subjects. Do a bit for each. But when you get close to SACs, just like the 1 or 2 days before the SAC, just focus on the one subject. I find it hard to focus on other subjects when there's a sort of test the next day. No, it's fine. I'm happy to answer those questions. And I'm I'm going to have like many VC lives in the holidays. So if you have questions, ask. And yeah, Max is, living the life in America. What are you planning to do in your holidays, by the way? I'm curious. But anyway, that's sort of it. I'll talk about some scenarios because it'll be better. But like there's not much to the interview. They ask you questions. Consider every person, the issue with each person, and then reply accordingly. Keeping in mind that you want to achieve the best possible outcome for the patient, and you don't want to like break any friendships. It's pretty like or break like privacy or any laws or things like that. I'm fairly sure it's common sense. But I think structure is something which is really good that you can try and do to really impress them, which is just giving a well-mannered answer. So your answer is well structured. You go through each person, and at the end you can have a concluding sentence, right? So you can say like, having addressed the whole family is concerned, both the parents and the child, I would then sort of act accordingly to that, which just shows that you just answered everything. Yeah, and apart from that, do dress like semi-formally. Dress like a shirt, wear a shirt, and like a not this shirt, like with a collar and everything, and also, what was it? And also, yeah, just speak well. You can do some hand gestures, be firm, and remember to also look at the camera. When I practiced with my friends, a lot of them didn't look at the camera because you're not really used to it, but really do look at the camera. So my camera is there, but my face is like lower. I try and look at the camera as much as possible. And just be polite. When you see people, say hi. Don't feel like it's a really formal interview. Just be like a good person and do the interview properly. Oh, you're going to California? Oh, nice. It's gonna be really cold, isn't it? Like America's just cold because it's in the northern hemisphere. Do you think having doctors as parents? Yeah, I would say having doctors as parents is like good if you frame it well. Right? Some people just might think you're being pressured or it's just like you whatever. My parents are doctors, I'll be a doctor as well. But if you frame it as sort of because they're doctors, I've been in hospitals a lot. They've imparted to me a lot about what hospital life is like, what med school is like. Having understood all that from a point of view that not many people have, I really want to study medicine. I think that's a very strong viewpoint to come from. And of course, only say it if it's true, right? If it's not true, then I know some people say stuff that's not true, but I don't think it's a very good thing to do. Let's have a look at a couple of scenarios. Oh, California. Is it like Melbourne, California then? But anyway, let's have a look at the scenarios here. So this is Fraser's UCAT. Like it's just a random website I found. Let's have a look. All right. So, do you guys want to have a read of the scenario? If you have any sort of thoughts, let me know. I think I'll just go through one scenario, and yeah. So, you're a medical student. Specialist asks you to perform an abdominal examination on an already under anesthetic patient. You're aware should not consent to this, but the specialist will be examining your abilities. What would you do? Right. So when I think about this, immediately, I think just as a normal person, you sort of have like a what I'm going to do scenario. You don't really consider things, you sort of jump. And for me, it's definitely prioritizing the patient and explaining to the specialist that I'd really appreciate if she had some form of consent. Right. So that's my sort of end answer. But then it's really a matter of explaining it because you get 8 minutes, right? And like you want to explain why you do things. So there are a couple people here. There's me, there's the specialist, there's the anesthetic patient. So I need to consider my relationship with each. Right. A relationship that a lot of people might omit is that of you and the specialist. I think it's really important to recognize, and you'll sort of realize this as you practice more, that like when someone's senior to you, having a good relationship with them is really important. And I would acknowledge that. I'd say there's a specialist who, is probably going to dictate my future a little bit because they're going to give me feedback on how well I did and they're assessing my skills as well. However, you'd ultimately place the patient first. Also, when you're in reading time, right, you can sort of think about things like that. So what's sort of the conflict here? Because there's always going to be a conflict. And the main conflict here is the fact that specialist wants you to do key skills, but patient hasn't given consent yet. And you can think about that and you can probably guess the first question is what are some of the issues here. Another thing with MMI is they oftentimes try and broaden it out, right? So it's good to do a little bit of research. I didn't do a ton. Did I get a transplant question? I might have gotten a transplant question in my interview, but you can do a bit of research on things like transplants, on things like diabetes, which are quite common. So for example, here, this is a broader question from this. Okay, so let's address each of the questions. What are some of the issues here? I would answer it like this. So I'd say there are many issues here relating to both the specialist, me, and the patient. So the patient hasn't given me consent, and the specialist, however, is assessing my skills. So you can give a bit of background, a bit of summary, and then move into sort of your answer. I am aware that my relationship with the specialist is really important. They will be in charge of providing me feedback, and this seems to be an important examination of my skills. However, my sort of responsibility to the patient as a medical professional is really important as well. The patient has not been given consent and is unable to give consent because they are seemingly under, or they are under anesthetic. In this scenario, I would try and manage both the relationships of the specialist and the patient, but would likely give preference to the patient, and especially because the patient's sort of health and like privacy is at risk here. So I would explain to the specialist that I'm not aware whether the patient has given consent, and I would ask the specialist whether the patient has actually given consent. And explain to them that I don't feel comfortable helping and analyzing a patient who has not given consent. And I would ask that you can also talk about like how you would ask certain things. I would ask that in a way that's sort of sensitive and not like saying, "Oh, hey, specialist, you're wrong," but in a way that's sort of appropriate as well. And that would sort of be my answer. Actually, that answer kind of includes what I would do next as well. But so the issues was included in that. Do I recommend getting a tutor? I didn't have a tutor. I don't think it's entirely necessary. I think if you're doing really badly and you don't know how to improve, then a tutor is quite useful. So I definitely recommend doing some papers by yourself. But if you do find a tutor, like I didn't use a tutor, but if you do need a tutor, either find an individual who scored really, really highly, because otherwise there's no point, or a company. But there are a lot of dodgy companies out there. I would say definitely find a friend or someone who went to a company and actually has like honest feedback about whether it was good or not, rather than just finding any company, because a lot of them are a bit dodgy. All right, so the second question, should patients in public hospitals have the right to refuse treatment from inexperienced doctors and medical students? This is a pretty obvious one. You always want to acknowledge both sides. So on one side, right, doctors and medical students, you're always going to be inexperienced at some point. You're not going to be like experienced. You sort of need your first time. But overwhelmingly, it's the patient's right, which is more important here. So you would talk a little bit about, how inexperienced people need experience, and we require the generosity of patients to do that. But you would heavily focus on the fact that, of course, patients have the right to refuse treatment, because it is their safety, and sort of they trusted us, and we should provide them the best service that they're comfortable with. Would your reaction be different if the examination was more invasive? For me personally, or not personally, but just for my sort of MMI stance, very rarely will my approach switch because something's more invasive. So it won't be like, okay, it's just an abdominal exam, I'll just go ahead with it, because it's not invasive. But if it was invasive, I wouldn't perform the exam. For me, that's like not a very good place to draw your line. The only thing that would change for me, so I wouldn't do the abdominal examination, or at least I would express my concern to the specialist. And the only thing that would differ is that I'd probably be even more conscious of the fact that she hasn't given consent if the examination was more invasive. And I think that's sort of the more correct answer here. It's a bit weird if for something small, you don't require consent, but something big, you really want consent. In general, you want consent for both, but for one, you want consent even more strongly, because of how serious it is. Let's see if there are any more questions. Hello Z. No, I haven't seen the movie Dune. Is it good? I've heard it's good from a mate today. Attila, good question. Do you have to consider the relationship between the specialist and the patient? You can consider it, which I do recommend you do, but there's not much of a relationship there. I would say heavily focused, because the main sort of conflict is you, the patient, you, the specialist. But I guess you can talk about hypotheticals, which I recommend doing if you really if you finished saying everything and you still have time. You can talk about how perhaps the patient is very close with the specialist, and the specialist knows the patient really well, and knows that the patient, and has done this many times with the patient before. But that's sort of making an assumption, and it's not really that important. I would say, and you would still like get consent. I don't think it's a reason not to get consent. But you can mention it if you have time left. And also in general, like specialists, unless you're a long-term patient with say like cancer or some kind of autoimmune disease, you don't really see specialists for like an extended period of time. Usually it's like they have an operation with you and then you're sort of done. But that's a good question. Yeah, all right. Let's have a look at the second scenario, and then I think there's not many questions, so I might like just finish up if there's not that many questions. I'm using IVF to predetermine the sex of your. Let me move my screen up. Is allowed in some places, but not in Victoria. Do you think it should be allowed? So with this question, there's genuinely like no right or wrong answer. This is actually pretty hard. I doubt they'd ask you this because there legitimately is not much to consider. Yeah, there's like not much to consider here. All you can sort of say is that sort of a personal choice. Whether I just don't think they'll ask you. It's a personal choice whether you should be allowed to predetermine the sex of your baby, and yeah. So follow-up questions for station 2. But you would say like, if you've done research on this, there's probably more to say. There's probably reasons why Victoria doesn't allow it. Maybe like it's playing God or something like that. So you can mention those reasons as well. And if you haven't done enough research into something, you can acknowledge that. You can say like, I'm not too informed upon this issue, but I would be fairly sure that Victoria has its reasons for not allowing IVF to predetermine the sex of someone's baby. What if a couple carries a genetic disease and more likely to affect a male child? Should it be allowed then? Yeah, that's a very difficult question also. You would say you'd probably consider the health of the child, but once again, it would be good if you knew why IVF is not allowed. Yeah, okay. So I just don't think this is a very likely question to come up. Yeah, we're just gonna ignore it. It's really not gonna happen because it's too hard and doesn't have many like medical like themes at work. Yeah, cool. So if you guys have any questions about med interviews, I'd be happy to answer them. Or if there's a particular scenario that you guys have seen that you found hard and you'd like me to go through, or if any hypothetical scenarios, like I'll leave the live on for a little bit more time. But otherwise, I have a practice mock day next week. If you guys are interested, send me a DM, an email, or just like let me know now in the comments. And so I'll be running mocks, and there's a price which I haven't decided. But it's like a full 8-station mock. Let me see if there are any other scenarios that I can find. So yeah, we just went through, for people who are just joining, I just went through for station 1. And yeah. Oh, also at the end of the interview, each question, at the end of the interview, they'll ask you whether you have anything else to add. And in that case, if there's something nagging in the back of your head that you wanted to say but forgot, then say it. For me, the people said like, that like they just told me not to say anything because it was sort of enough. I'd done well enough. So that's how I sort of knew I did well. Also with practice, highly recommend you practice with your friends, practice timing as well. Because for me, I found that I could hit the time if I was really comprehensive to my answers, which is good, right? So I knew that if I was able to consider everything, then my time would be fine. So it's really useful to practice with time with your friends and give really good feedback and look at the camera. That's really important. And like the way I talk, it's quite confident, as in I don't like look away a lot. I don't stutter a lot. I just sort of say what I want to say in a confident voice. And that's quite important. Manner is really important because that's where people get their impressions of you. Okay, a conflict between a specialist and a student. So it's not really for me to decide whether. I'll go back to the thing. Okay. Let's go here. Yeah, it's not really for me to decide whether something will come up or not. I don't think this will come up because of the fact that when you think about what there is to say about it, there's not much, right? It's like, um, there's one scenario where you're not either of them. You sort of hear that they have different opinions. In that case, right, it's the classic, right? I do trust the specialist a little bit more, but I'm not going to trust them wholly because of their experience, which is important. You don't want to be like really right or really left. Like you don't want to be very one way or the other. You want to consider both sides. So I would say, I slightly value the specialist's opinion. Probably has more credibility because the specialist is more, what do you call it? Like experience. But I would definitely listen to the considerations of both. I'd really want to know why the student thinks it's this cancer in this area. I want to know why the specialist thinks that it's not cancer, but just some kind of growth here. And preferably, I would have both of them come in and sort of talk to each other and explain to each other why they think certain ways. And that direct communication, which is really important, will hopefully help them reach the right answer. If not, I will try and organize further examinations. Ultrasounds, MRIs, not really an X-ray, but things like what do you call it when they take a biopsy as well. So if you know a couple examinations, you can say that will really help us confirm if their discussion is not fruitful. So that sort of covers all the bases, right? Covers the specialist student. The other scenario is where you're the student, and like, let's say the specialist thinks a certain thing, but you're like, I don't think this is quite right. I've seen something in med school and it's not quite right. I would say, and then I would say definitely voice it. So once again, I sort of skip to what I'm going to do and I'm going to voice it to the specialist, right? But now I need to explain to the examiner why I'm going to do that. So I say like, I think it's very important to communicate to the specialist my worries. I do understand that specialists have many like decades more experience than I do and have more knowledge, but I would approach the specialist in a very sort of open and not like, hey, you're wrong kind of way, and explain to them why I think a certain way and just be very prepared to sort of realize that I'm wrong. But I just really want to sort of share it with them and see what they think. If I'm right, then great, we've saved a patient. If I'm wrong, then like I've learned something and I've learned why it's wrong clinically. So yeah, it's good to consider what will happen if like both. It's good to consider hypotheticals. Like if I'm right, then if I'm wrong, then and same with if I wasn't the student or the specialist, right? If they reach a conclusion through direct communication, great. If they don't, then we might need to order some further examinations in the future. I hope that helped, Boo. I'll just write a couple things down. So, scroll down. And the second scenario is where you are the student, and then sort of once again acknowledge specialist seniority, but do voice your own opinion. And the way you show that your sort of decision making was correct is the fact that, like, I voiced my own opinion. If I'm right, I save a patient or whatever. If I'm wrong, I learn something. Like, they're both really, really good outcomes. Cool. Any other questions that you guys have? Otherwise, I'm very happy to end the live at 9:05. And of course, if you guys have any more questions, you can always like message me, DM me, etc. Any scenarios, any hypotheticals you think that might come up? Yeah. And also, one thing is that the more you practice, you realize a lot of the scenarios are similar. Like, direct communication is a big part of a lot of scenarios. There's always like conflict, and you want to communicate directly with that person, or you want to get those people to directly communicate with each other. Because once you start, it's really easy to think a certain way until you're exposed to people who think differently directly, right? So that's the case here. You try and get the specialist to talk to the student, and that usually yields an outcome because they realize that one person's wrong or one person's right. And usually med, it's clear cut, right? It's either this tumor because of these things, or it's not, it's this cancer because of these things. It's not really like a philosophical question. But you can also acknowledge that, if it's not fruitful, then we can order further examinations. But you never really want to say like, okay, we're just going to disregard the student, because that's very, very extreme. Unit 3-4, tips wise, or what subject you're doing, I can give more specific tips for that. But in general, I'd say for most of the year, you don't need to focus entirely on your 3-4. I think that's a very bad mentality because you get really nervous as you've placed everything onto one subject. And balancing with other subjects like really helps your 3-4 as well. If you're doing well in other subjects, you just feel better. And I think your mind just works better if you're doing well in many subjects. But towards the end of the year, of course, focus on your 3-4, start exams early. And because you have more time to devote than someone in year 12, but also keep like a clear head. Remember that it's only one subject out of 6. And I think that sort of hard work combined with that calmness, it will achieve the best possible result. But yeah, what subject are you doing? Any more questions? If not, I'll end it at like 9:10 or 9:08 or something, if there are no more questions. But yeah, good luck for your interviews. If you guys are watching, it's just be calm and like legitimately, if you go through every person, you're not really gonna miss anything. If you think about each person, their relationship to you, perhaps their relationship with each other, like the example I gave of the parents and their kid, as well, and like you're not gonna miss anything. And just think about how to address it in a smart way. Oh wait, your username is methods as well. Methods, I'd say start practice exams pretty early. Yeah, and try and cover the content quite early as well. And also, I highly recommend because that yeah, do those two things. Also, I highly recommend keeping a list of your silly mistakes and also really hard questions. So you sort of have two types of things you get wrong, right? One type is like you know how to do it and you just mess up something, forget to label points or whatever. Make a note of that in perhaps one book, and really each time you do a test, every time you do a test, make sure to sort of go through those things as a checklist, and that way it will become like really big habit, and so you won't make those mistakes the later it gets in the year. The second type of mistakes are when you don't know how to do something or you didn't know like like tangent is very flexible. Sometimes you don't realize you need to use the tangent when it says like fastest or something like that. And those type of mistakes, also write them down, because they're sort of unknowns and you don't want to make that same mistake again. So remembering your two types of mistakes, making a list of them, plus trying to finish the content early and starting practice exams early. Those are two really, really important things. And do practice exams properly. What time is it in U Chicago, Max? Is it like, is it like midday or? Oh, also, are you celebrating Christmas in California or in Chicago? 4 a.m. Thanks for joining my stream at 4 a.m. What were you doing? Playing like Minecraft or just chilling? Tangents and multivariable calculus. Yeah, I think I heard some people at Melbourne were doing that. Is it harder than Spesh, you'd say? Oh, also, someone I play basketball with called Ryan Lobo. He's going to U Chicago for swimming and like academics, and I passed your name on to him. I'm not sure if he DM'd you, because I gave him your Instagram. Cringe. Okay. I saw Jim came back. Oh, I'll message you more, but any more questions? Oh, Shang, hello. I saw you at the basketball game. Do you have any questions with interviews, med interviews? But you can always DM me as well. You sort of came at the end of this session. What's my best tip when going into year 12? Probably two tips. I'll give you two tips. One is stay on top of your work. Okay, never get behind. And also always like try and do things early. So if you have time at lunch, just finish your homework, right? Because you never know what you can have at night. The second thing is focus on yourself. Right? I don't really care about what other people are doing. You're probably going to care about how they're doing SACs, but don't care about like how they're studying, how many essays they've done. As long as your work is working for you, focus on that. Unless there are things for you to sort of learn from other people, like you want to learn how they study, then that's fine. But don't get distracted by people studying like 200 hours or whatever. And stay on top of your work. Those are my two big tips. Cool. All right. I think I'll end the live then. Oh, tips to counter procrastination. I say try and get things done sort of at school is quite a useful tip. I sort of stayed sometimes after school, and at lunch as well. Sort of when you're with your friends and everyone's all studying for VC or school or exams or whatever. It's easier to get things done. And when you get home, I guess there are two ways, right? One is having a schedule. So I always do work from 6 to 8 or something like that. So you get into that. Uh, Also going home and doing stuff straight away. That's a really good strategy. And also like calling your friends, right? Like doing a video call and finishing your homework. I think that's definitely less productive, but use it to do work like maths questions or something where it doesn't require. I don't think writing essays is a good thing to do with other people, because you really need to be deep in thought. But maths questions sort of bang bang bang. It's a good thing to do with friends and they keep you accountable. So yeah, basically surrounding yourself with other people, or having a schedule. Both are good ways of countering procrastination. No, I don't do any maths in med. There was like there's like some maths questions about why when you put water in a red blood cell, the blood cell like explodes. There's mathematical reason because the concentration's greater in the red blood cell. So it tries to equalize. That's the most extreme maths I've ever done in med. Is there anything else? A little pH, like one pH question. Yes, yes, you will, Max. Exciting times. Best tips to do well in 3-4 special. Make sure you understand each question you do and why you get questions wrong. Because special, I would say the questions like Max did special as well. I don't know what your input is. Like feel free to share your input. But essentially, the questions are pretty similar each year. And so when you get a question wrong, it's really useful to think about why you got it wrong. Did you misunderstand the formula? Did you um, rearrange the formula wrong? Did you not realize that it's hard to explain when you haven't learned 3 4, but like this particular concept can be used in this type of question. Did you not consider friction in this particular question? But because each year the questions are pretty similar, if you know why you got questions wrong, you can really avoid mistakes down the path. How did I go about acing UCAT? So I actually hadn't started UCAT prep this time last year. It was about January. There was one workshop with Dr. Ray that I went to, which was okay. But I bought the med entry things and I started early January. I think 19th or a little earlier than that. Um, and I'd started doing one a week, and I basically maintained that most weeks. One exam a week, usually on Saturday, like a full mock exam, and in between I'd work on stuff, whatever. But I would really try and keep that consistent, and that was quite something I would do early on in the year. I definitely start getting into exams early, not to get them done, but because UCAT's kind of hard to adjust to, and so starting to adjust early is really good. Yeah, Xiang is actually tutoring UCAT. So you guys can like message him. I'm sure he's happy to share whatever his details are. He did really well in UCAT this year. Very worried about doing two maths. Two maths, a lot of people do two maths. Like I'm sure you can definitely do great. And it's good when the subjects are not the exact same, but like they're in the same field. I feel like your brain works well with those kind of things. Like if you do English and Lit or English and language, I don't know if Max agrees with that, but English and Lit, it's just writing. Except one goes a bit deeper, one doesn't go as deep, but it's all just writing. So it feels quite good, I think. And I'm sure you can always ask me for help. But maths is like a very consistent subject. All right, if there's nothing else, I will end the live in 2 minutes. Yeah, don't like enjoy your holidays. It's not there's like a fair amount of time till the school year starts. I didn't know methods and spec help in uni. I guess if you do like science, or if you go to America. Yeah, Lang, I'd say it's still English related. So I find it like very specific English, and I thought it was quite nice. But admittedly, it's probably more different to English than Lit is. Yeah, unless you know. Yeah, actually, like most subjects would probably use math, right? Like, even like commerce and stuff like that. Yeah, yeah, I agree. Spec helps a lot in like a lot of math subjects build upon spec, and methods is just a prereq for a lot of courses anyway. Ha, bit of a king. Flexes his vectors knowledge. Oh, vectors is actually useful in med. I forgot. I didn't know because when you measure someone's electrocardio, like their heart movements, you got to stick like things like positive, negative, and if you draw out the vectors, it works out well. Like it's a good way of understanding why people place the electrode in certain places, which was pretty cool because vectors, I realized vectors are actually useful. Cool. All right. I will end the stream then. Thank you guys for joining. If you have any more questions about med, or interviews or anything, feel free to DM me or leave a comment. I reply to comments the quickest on YouTube. And let me check. I think someone just. But yeah. Anyway, I will catch you guys later then. Have a good holiday.